What are the advantages and disadvantages of using Alma for your psychotherapy practice? America Alcala, licensed clinical social worker, and Alma was one of the first services that I started using to build my own private practice. So I want to share some of my experiences with you. First, what is Alma? Alma is a membership-based directory and insurance billing platform. So you get, as a therapist or a client, you get all kinds of services. For clients, you get a free directory so you can browse and find a therapist that's good for you. If you are a therapist, it has insurance credentialing, which gets you paneled with different insurance providers, insurance payers. There's also billing management, which is nice. You can submit claims to those payers, and Alma does all the legwork, all the administrative work to make sure those claims are filed correctly. And then you get client referrals. If clients are finding you on the directory, then they will reach out to you, and you get a client referral, and then maybe you can work with that client. The administrative and EHR tools are important. It provides an electronic health records platform, so keeping your progress notes, treatment plans, um, keeping your invoices all in order. All of this is on Alma's platform, so it's organized. And then, of course, there's the community of peers. They have the Alma Forum, which connects you to therapists all over the country and also within your state where you're licensed for your practice, so you can share information. So some of the advantages of Alma within the services that it provides. Advantages. It's affordable. If you sign up for just a month, I think it's about $125. But if you go for the entire yearly subscription, it comes out to about $75 a month, which isn't too bad considering that the other advantage that I'm about to tell you is Alma pays out much more for reimbursement rates. So compared to, like, let's say, for example, Grow Therapy or Headway, two other platforms that I have experience with, Alma tends to pay significantly more across the board for different insurance payers. So whatever you're spending on the subscription, you tend to make back because you're getting a bump in those reimbursement rates. The EHR, the electronic health records platform, is pretty easy to use. You just have to navigate tabs for clients, billing, calendar. It's all pretty straightforward. Submitting claims is very easy. You throw in a CPT code, you throw in the diagnosis, and just click a button submit, and Alma will handle the rest as far as making sure it gets filed correctly with the insurance payers. Paneling is very quick. If you go independently, it can take months and months just to get paneled with an insurer, like let's say Aetna, for example. But my own experience, when I signed up with Alma, within weeks, I was with Aetna, I was with Cigna, I was with Optum, and I was ready to go and start receiving clients. So if you're trying to get your practice off the ground, this is a very quick way to do it. Payments, the reimbursements are nice because they come quickly too. So I said, the payments tend to be higher for reimbursements. Not only that, they come within a week. So it's nice to have a steady income weekly. Reimbursement rates, talked about that, but then also the community forum. So this is huge. I was having a little bit of trouble getting referrals initially, just on my own, people finding me on the directories, clients finding me, and you go on the forums and you can look for what's called ISOs, in search of therapists that are trying to find a client, a new therapist. They might post something on one of these ISO forums, and you can tell them, hey, this is a good fit. I do that treatment modality. I have that same availability that they're looking for. Um, so, here's my information, and you can pass that along to the client. I would say I've gotten the overwhelming majority of my clients through that method. And then the last advantage that I would list for Alma is just the cancellation fees. You can charge cancellation fees on Alma. Grow Therapy, for example, doesn't allow you to do that. So I've found that there tends to be a higher no-show, late cancellation rate. Whereas if you have cancellation fees in place, it's good. It just increases adherence for clients to show up to therapy. And so there isn't a disruption of services, and your time is being used well as a therapist. Disadvantages. Well, let's talk about the disadvantages of Alma. You have to pay a monthly subscription. Like I said, that's not too big of a disadvantage just because it tends to be cost effective if you do the yearly plan. The video platform, I'm not too crazy about. It seems to have a slight pause in audio whenever you speak and the client speaks at the same exact time, which can happen in the middle of a therapy session. So I actually use Simple Practice for my video platform, but I still use Alma's whenever I do consultations, just because it's easier sharing the link with clients when they find me for a consultation request. Um, but I don't use their video platform long term. Another disadvantage, you can't create your own documents in Alma. Yes, you can send a patient health questionnaire. Yes, you can send a generalized anxiety disorder questionnaire, those scored measures, which is helpful. But beyond that, there really isn't a lot you can send to your clients. On Simple Practice, for example, it's more robust, so I can send PDFs, worksheets. I can send other scored assessments for substance abuse, grief, and obviously anxiety and depression. So there's just more to work with on a platform like Simple Practice. The EHR that you're getting with Alma is very, very bare bones. It just has exactly what you need to get therapy done. But if you're looking for more tools, then I would recommend looking elsewhere. Um, and then finally, the referrals. I mean, my experience with the referrals, like I said, I tend to get most of them through the ISOs, the In Search Of posts that are on the Alma community forum. I don't see a steady flow of them just with clients finding me on the directory, and there could be a whole range of factors that have to do with that. I mean, um, maybe it's because of my treatment modalities, and maybe those that's not what clients are looking for. Maybe there's just a lot of therapists on Alma, which it seems like there are. I do get a few referrals per month just by being active on the community forum. So it depends. I've heard some good stories where people are getting multiple referrals per week. Other people aren't getting anything at all. Other experiences are somewhere in the middle. I've heard all of this on the Alma forums. So it really depends. It just really depends on the time and what clients are looking for. So as I've expanded my practice and added more treatment modalities and training, I do see that it's picking up. So it just takes a little bit of time. So those are the advantages and disadvantages of Alma. If you like this video and you found it helpful, special request, just please look in the comments below so that way you can find my referral code. It helps to aid my practice and keep it going so that way I can help clients that need therapy. So I appreciate it. Have a great rest of the day.